Hello, this is Mark Goodwin. I'm going to spend a little time with you talking about my study abroad to Nicaragua with the College of Allied Health Sciences. And this trip occurred in March of 2013. We left Cincinnati, Ohio on a very cold March 15th, flying down to Managua, Nicaragua, and then from Managua we used ground transportation to Granada. Granada was the headquarters for most of our projects. The Ministry of Health tries to coordinate health services throughout the country. And there are 17 administrative units corresponding to the country's departments. There's the public arena, which is hospitals, clinics, outposts, even homes. The majority of the population, including the unemployed and informal workers, have access to the public system. It is free of charge, but because they are unable to pay into the system, it's funded partially by the state, but primarily by international donations. Japan is a big donor. Then you have the Nicaraguan Social Security Institute. Then you have non-governmental organizations in the mix. NGOs fill the gap, providing care to many communities without access to health care services. This could be charities, Doctors Without Borders, and finally, private insurance, private pay, even private hospitals. Nicaragua has a long history of dictatorships, wars, corruption, and disasters. These factors have impeded the country's economic development, making it the poorest in Central America. Years of military spending and government corruption have limited the ability to invest in social programs. Adult literacy is 77%. Per capita gross national income in U.S. is $2,720. 48% of the population live under the poverty line. 73% of households in rural areas have an unsuitable water supply. 33% of the country's households have no electrical service. Rates are twice as high in rural areas. 59% of households use firewood for cooking. 20% of the children under the age of 5 suffer from chronic malnutrition, and the mean life expectancy is less than 70 years. This is Carrie, the director of Viva Nicaragua. She helped make our stay fun and meaningful. While several social work students volunteered in schools and squatters communities, I went into the Pedro Jose Chamorro Health Center, or La Primera. La Primera is one of Granada's busiest clinics. The entrance of the front of the clinic stacks all the cooler boxes that contain vaccines going out into the community. In the morning, the hallways are crammed with patients lining up outside various examination rooms that crisscross and divide the clinic. La Primera makes its own bandages to save money. We helped make about 1,000 bandages the day we were there. At the back of the clinic is the main consultation room. Larger than most other spaces at the center, this room sees 2 patients at a time, with 2 doctors and a nurse working constantly. They have a strong focus on sexual health, as 40% of their patient load consists of pregnant teenagers. They do lots of testing for STDs and Pap test procedures for the prevention of cervical cancer. Other services they provide are dental checkups, pre- and postnatal care, lab tests, and nutrition consultation. They also do regular checkups, give educational workshops about disease topics. This is the nutrition office. The nutritionist sees about 10 to 20 clients each day in the field. She first offers a short lecture on eating properly to those waiting in line to see a doctor or nurse in the field clinic. The health center also has a satellite clinic in the village of Pantanal. just a 10-minute drive from the clinic in Granada. Pantanal is a poor community of about 10,000 residents just south of Granada. In Pantanal, there are no paved roads. Here, there are no brightly painted houses or music-filled watering holes. This is a place of shanties, lean-tos, and squatters. It lacks the basic infrastructure you expect even in the most impoverished of places. The community is grown over Granada's main aquifer. There is no potable water or sewage treatment of any type here. This will soon be a big problem for everyone here and in Granada, as this gray water will start to percolate and enter the groundwater, bringing disease. This is outside of the outpost clinic. The doctor will see 30 to 40 people in the morning alone at the outpost clinic. Everything from immunizations to pap tests, HIV, well baby checks. This is the doctor's main office at the outpost clinic. As you can see, the coolers in front that the nurse uses for injections and medicines. On the other side of the shelter is a blanket on a rope, which provides privacy for examinations. Acute respiratory infections, diarrhea, and vector-borne diseases such as dengue, hemorrhagic fever, and malaria are the main communicable diseases in Nicaragua. Medications are provided free to clients. This is me playing Simon Says with some of the 30 children in line to see the doctor that day. The nutritionist counsels pregnant mothers in the outpost clinics. She discusses proper eating and tracks the mom's weight gain or loss, and pregnant mothers receive a prenatal vitamin and a folate capsule. She will also prescribe clinical tests like triglycerides, A1C, and counsels on healthy eating for diabetes. Mothers are encouraged to breastfeed for as long as possible. The doctor, the nurse, and the nutritionist all make home visits. Now, I encourage each of you to participate in a study abroad. Contact UC International or see if there's a UC faculty-led group going somewhere that you would like to visit. This is UC International's website. Grants are available. Not only will you learn a lot, but you'll have fun too, like we did.